pn8. QA client visiting a family planning clinic is suspected of having an STI. The most diagnostic test for treponema pallidum is a venereal disease research lab, VDRL, B rapid plasma regan RPR, fluorescent treponemal antibody FDA, D Thayer, Martin culture, TMC rationale. FDA is the only answer choice for treponema pallidum. Answers A and B are incorrect because VDRL and RPR are screening tests for syphilis but are not conclusive of the disease. They only indicate exposure to the disease. The Thayer-Martin culture is a test for gonorrhea, so answer D is incorrect. Q. The nurse is caring for the client following a cerebral vascular accident. Which portion of the brain is responsible for taste, smell, and hearing? A. Occipital, B. Frontal, C. Temporal, D. Parietal rationale. The temporal lobe is responsible for taste, smell, and hearing. The occipital lobe is responsible for vision. The frontal lobe is responsible for judgment, foresight, and behavior. The parietal lobe is responsible for ideation, sensory functions, and language. Therefore, answers A, B, and D are incorrect. QA client with non-tropical sprue has an exacerbation of which meal selection is responsible for the of the client's symptoms? A tossed salad with oil and vinegar dressing, B. Baked potato with sour cream and chives, C. Cream of tomato soup and crackers, D. Mixed fruit and yogurt. Symptoms. Recurrence rationale. Symptoms associated with non-tropical sprue and celiac disease are caused by the ingestion of gluten, which is found in wheat, oats, barley, and rye. Creamed soup and crackers contain gluten. Answers A, B, and D do not contain gluten, therefore, they are incorrect. Q. The registered nurse is conducting an in-service for colleagues about peptic ulcers. The nurse would be correct in identifying which of the following is a causative factor: A. N. Gonorrhea, B. H. Influenza, C. H. pylori, D. E. coli rationale. H. pylori bacteria has been linked to peptic ulcers. Answers A, B, and D are not typically cultured within the stomach, duodenum, or esophagus, and are not related to the development of peptic ulcers. Q. Which of the following normal blood therapeutic concentrations is abnormal? A. Phenytoin 1020 micrograms ml, B. quinidine 0206 micrograms ml, C. haloperidol 0520 ml, D. carbamazepine 525 micrograms ml. Rationale: the normal ranges of carbamazepine is 10-20 micrograms ml. QA client visiting a family